I'm going to be talking tonight about nutrition for digestive health. I know a lot of the same information. I talked to a lot of different nutritionists about this specific information. A little bit of background about me. A couple years ago, I was having a ton of stomach problems, basically pain kind of throughout my body. One of the things that I didn't know was that I was very sensitive to food. I've come to figure out how to understand a lot of this digestive issues because I've gone through it myself. I stopped eating gluten about 2 years ago. When I stopped eating that, I did not realize how systemic the problem was in the body. It was affecting my joints, and so like I had arthritis. And when I stopped eating gluten, my ring can now almost falls off. You can see how that slides off so easy. I couldn't get my ring off my finger for like 2 years. So the joints are swollen. So if you're dealing with arthritis or any kind of joint pain, a lot of times it's going to be related to foods that you're eating, and it's going to cause problems throughout your body. It can attack the brain. It can attack different organs. The colon is one of the main organs that it attacks. It can attack the whole digestive system. So we're gonna go on a little journey tonight to understand how the foods that we're eating are impacting our entire body, more so than just the digestive system, because the digestive system is hugely important on how the rest of the body works. And so we're going to talk a little bit about background information. Some of this will be very basic for some people. Some of it will be new for some of you who don't know a whole lot about the whole nutrition and digestive system here. So we'll start off with just some basic nutrition. And then at the end, I'm going to have time for questions. So if you have specific questions about anything, or as we're going through, if you want to stop and ask me about anything, just let me know. So, okay, tonight we're going to talk about eating the right way, how to prevent disease, and how to manage this autoimmune thing where the digestive system and the immune system will be attacking our body. Is it important? Well, these are some of the diseases that they say can be prevented by changing the diet. Type 2 diabetes, we're spending about $90 billion a year on that in the United States right now. Obesity, $100 billion. Heart disease, cancer, lots of money being spent on that. And then autoimmune. This is one of the fastest rising diseases that we've seen in the last 10 years. Just about every day we're seeing more and more people that are being diagnosed with this autoimmune thing. So if we come back and we check on this number in just a couple years, we're going to see that that number is going up very rapidly. So how many people know somebody with an autoimmune disease? Yeah. Within a short period of time, almost everyone will know this. A lot of the people that have autoimmune diseases right now, they're not even aware that they have them. So why are we so unhealthy, or why do we have so much issues with this digestive thing and with the food that we're eating? A lot of it's misinformation. So we watch television. What are they trying to do on television? They're trying to sell us a food, and it's not based on how healthy the food is. It's based on how does it taste, or how fast can we get the food. So unfortunately, we're not being sold healthy food on the television. We're being sold food to make money. Outdated information, unfortunately, even in going to a nutrition seminar, unfortunately we're getting a lot of misinformation or outdated information. The information is changing and evolving very rapidly, so what we thought was true 5 years ago even may not be true now, especially with things like soy and some of these diet foods that they're talking about. They put them on the market, they think that they're healthy. Soy, for example. In the last 10 years, there's been a huge push to eat more soy. As people start eating more soy, they come to realize there's some big problems with eating soy. And so we start to understand that that's not a good thing to do. Misleading labels. The FDA regulates a lot of things. Some things they don't. And there's certain categories or classifications. So if we say something is sugar-free, that means it has to have less than this amount of sugar in it. It doesn't mean that it actually has to be sugar-free. So when we look at sugar substitutes, a lot of the filler in the sugar substitute is still sugar. So even though we're eating something that's sugar-free, it still has sugar in it. And then poor food quality. As we overproduce in the same rounds, we're losing food quality. So a carrot today versus a carrot 20 years ago, Same carrot grown in the same spot, you're going to see a lot less nutrition in the carrot today than what we saw 20 years ago in the same carrot.